My name is Arjun Saxena, and I'm one of the CEOs of AAA Against AIDS. In the 1900s, the HIV and AIDS virus was discovered by puzzle scientists who did not know where this viral disease came from. But after further research, they discovered that AIDS was shown in New York and California in the homosexual population. This was the first discovery in the United States of America. They developed a rare infectious cancer that seemed to be resistant to any treatment, and this spread quickly, thus being obvious all the men were suffering from a common disease. HIV and AIDS are a disease that affects the human immune system. To understand AIDS, one must first learn about HIV. HIV is the short form for human immunodeficiency virus. This means that it makes the immune system deficient, hence the name. Haha. To state simply, HIV lowers one's resistance to disease by compromising the immune system of the body. HIV attacks very slowly and can take up to a decade in a person who has tested positive for HIVs. It is an acquired immune deficiency syndrome. It is closely related to the HIV virus. AIDS appear in a person who is infected by HIVs during the final stage of the HIV syndrome. HIV takes place in the body after the immune system is rendered useless against foreign invaders such as bacteria, viruses, and other foreign diseases. AIDS even may be linked to the development of some cancers. So, the first stage of HIV is when a person has none of the AIDS-defining disease and a high level of immune cells to fight the infection. The immune cells are called CD4 plus T cells or CD4 cells. Our colleague Dylan will talk more about those in his presentation. The second stage, the levels of CD4 cells dramatically decrease. In the final stage, stage 3, the HIV, where some have at least one AIDS-defining disease and an extremely low amount of CD4 cells. AIDS is a sexually transmitted disease, or an STD. If a person commences anal, vaginal, or oral intercourse with a person who has AIDS, they have a chance of being infected. During sexual intercourse, the virus comes into contact with the body through fluids, which include human breast milk, semen, vaginal fluids, and blood. If a small drop of fluid from an infected person touches a clean person, it can transmit this virus. Another large cause of AIDS is the result of sharing and reusing the same needles and syringes. If an infected person pierces themselves and then shares the needle with a non-infected person, the person who is non-infected will have a chance of getting the HIV virus AIDS because it was in their blood. A more unusual method of transmission is through maternal means. This includes pregnancy, childbirth, and breastfeeding. A woman who has tested positive for HIV can transmit it to their children during pregnancy or during childbirth. However, there is only a 25% chance of this actually occurring. Since breast milk is a bodily fluid, it can contain HIV/AIDS virus. So if a mother has it, she can pass it down to her children when they're breastfeeding. Symptoms include night sweating, short breath, chronic diarrhea, long-lasting white spots, unusual lesions on the tongue, mouth, headaches, fatigue, blurry vision, weight loss, and skin rashes and bumps. Thank you for listening. That's all the time I have, and it's back to you now, Dylan.